My name is Robert Seik and I'm a pharmacist. I live in Las Vegas, Nevada and own Pellets Specialty Pharmacy. It's a pharmacy that's been in business for 18 years and I am a compounding pharmacist. We provide many unique solutions for integrative medicine. We focus on bioidentical hormones, intravenous nutrition, pharmaceutical grade supplements, and pride ourselves on being a resource for patients and for medical practitioners in integrative medicine, hence our enrollment and membership in the A4M fellowship program. Well, I started my pharmacy career in a retail pharmacy like many pharmacists right out of school, and very quickly I was dismayed at the fact that patients took so many different medications, and there was a medication for many index diseases, and I just thought to myself that it didn't make sense that the human body should just fall apart like this and we should need all these medicines to keep us healthy. I had an interest in integrative medicine but didn't really have a pathway to that right away, so I chose to go into the drug industry and actually worked in clinical research for about 10 years, calling on a number of clinical trial sites, working with antiviral drugs and such. And it was actually exposure to the A4M conferences where I actually thought, now this is a pathway I can learn about integrative medicine, and got into compounding pharmacy with supportive materials for things like herbs, nutrients, hormone therapy, and thought this is the place where I need to be to teach people and interact with physicians on a higher level of health. The pharmacist is in essence a free healthcare professional because patients and doctors can call us or walk into the pharmacy at any time to ask questions. So it's very important for me and my pharmacists that work with me, all of us are enrolled in the A4M program to become a knowledge resource for the patients because the public wants to know about hormone therapy, pharmaceutical grade nutritionals, and we've become a resource for that. And for the physician, it's always good to consider the pharmacist as a treatment consultant. So though the pharmacist never replaces the physician, I've just found a lot of reward in terms of my career in working collaboratively with medical practitioners that want to ask questions about labs. It's very rewarding to ask certain opinions on how to adjust a dose and create the exact formula that a patient needs in terms of the dosage form and the exact amount. So it's that consultative interaction with both the physician and the patient that makes that triad work. Hormone therapy is available in many means: topical creams, capsules, and one of the first means that hormones were actually developed to be delivered over a long period of time is with compressed pellets. This technology has been around since 1938. It's very unique, it's something that we really like at the pharmacy level, and I've actually found some good resources where we're able to bring this information to physicians, and without any sort of franchise fees or agreements, we actually offer through our company. It's called revitapell.com. That's our trademarked name, where we have a website and we show lots of information for the medical practitioner and for the public on hormone therapy, specifically by delivery using pellet implants. Pellets are the most physiologic means to mimic the body's natural way of producing hormones because you get a long sustained release. And unlike creams or capsules that have to be dosed every day, or injections that might be painful and have to be delivered once a week, this gives the practitioner and the patient another option where they can have one procedure. And for example, testosterone pellets, the most common pellets that we make, in women can last 3 to 4 months, one treatment. In men, 5 to 6 months, one single treatment. And what I noticed in terms of comparing testosterone pellet therapy to therapies that I researched in the drug industry, whereas you may have one particular medication that is used to treat a couple of different diseases, testosterone pellets alone in both men and women can solve just a large number of problems. So for one drug, one treatment, or 3 to 4 treatments a year, there's just a tremendous number of advantages. If you'd like to know more information about our pharmacy, you can visit our website at pharmacist.com. We also have information on our sister website on the hormone pellet therapy at revitapell.com, or the aesthetics device that we have to distribute at parteldermaroller.com. On each of our websites, there are links for patients to reach out and actually find a medical practitioner that's associated with us. So the pharmacy, again, becomes the resource for the public to find a bioidentical hormone practitioner. And also, the providers can click on a link to contact us directly so that we can keep them informed of events that are coming up, and we can even talk about training wherever it is in the country on any of the items that we have, the pellets, the derma roller, or reach out to one of our A4M trained pharmacists to talk about bioidentical hormones.